There it is.
Okay. I'm gonna go here.
And that's it. We're live.
We're live. Okay. Hey, everybody. My name is Laura. I'm filling in for Travis again. Today is Wellness Wednesday, and we're here with Nick, and we're going to be talking about Dr. Google and knee pain. So, Nick, I'm going to do what we did last time. I'm going to pull up Google, click on an article, and we're going to go through why the advice is good or bad.
This is great. This is so much fun. Let's do it. And again, perfect, like how to get rid of knee pain. Very common thing I think that you're going to see typed in as shows by it just popping right up.
Right. All right, let's do the WebMD one. It's a very popular site.
Yeah.
All right. They have 11 do's and don'ts for knee pain. The very first thing they have is don't rest too much.
I agree with that. Absolutely. Like, it says don't rest too much, and the second one is do exercise. Like, I think both of those, that's a great place to start. You're not supposed to just completely stop moving. Now, are you going to have to modify those, and is it going to depend on the person every time? Yes, absolutely. That being said, I still think that those are two really good places to start.
Okay, so like if I have knee pain though, how do I know if I'm supposed to rest or if I'm supposed to get moving? Like, is there like a balance? Does it depend on the injury or what kind of pain I'm feeling?
Yeah, I mean, it does depend on, in large part, as far as what's going on, right? But also what you said, kind of the pain too. So if I'm just standing here and I have a 3 out of 10 knee pain, right? And I start maybe doing some squats, I'm doing some lunges, just some things back and forth. I go out for a walk and that pain goes up to a 4. I'm not really worried. If it's getting up to a 5, not too worried. But if it's going past that, like usually it's that 2 points, like beyond 2 points on a pain scale, you don't want to push too hard. And you also want to take note, maybe it only goes from a 3 to a 4, but it stays at a 4 for a day. It's probably too long. If it stays at that 4, you get off it, 10 minutes later, it's back down to its just normal level of a 3, then no big deal. Like it wasn't just that long-lasting, profound effect of pain.
Okay, gotcha. All right, don't risk a fall.
Yeah, I don't know. Yes, I absolutely agree, right? But that just seems
like common sense that you should try to avoid that anyways.
Yeah, that's why I'm just I don't know. That's just they made it go from 10 to 11. Need do's and don'ts with that, I guess.
Yeah. Okay, rest, ice, compression, and elevation.
Okay, so this was one this is one I want to dive into a little bit for people because I did these searches and stuff a little bit beforehand to see what was going to come up, and I'm for the most part not going to agree with Rice. So rest, no. You as far as what we talked about first, you got to get up and move a little bit more. Ice, maybe yes, maybe no. It depends. I even did a bit of research this morning on ice versus heat. Like, does it really matter? And ultimately, no. It's going to be more what feels good for you. For some superficial swelling, it can help out a little bit, but it has to be very superficial because the temperature change from like 1 centimeter, it's only going to change maybe 2 degrees Fahrenheit, about 1 degree Celsius approximately, right? And that's a centimeter, right? So if I'm thinking even just the width of my thumb, well, the amount of skin and just fat, right? It's going to be tough to actually get into a muscle, into a joint, to get to a nerve to help calm down, like where the inflammation almost really matters.
So
Now,
is heat and ice more like a distraction from what's going on?
bingo. Yes, that's exactly what it does, actually. It provides what's called an analgesic effect. So think of a numbing sensation, right? Like that's what it does. It gives so much input to your nervous system, to the sensory nerves, the nerves on the outside there. And really, it just tells them that there's not as much pain being present. So it gives more of a distraction to the nerves.
So
Now,
go ahead.
Well, I was going to say the compression. So compression can be a good thing, right? Because it can help, especially if there's that superficial swelling. But again, you don't want to rely on that as the only way to get rid of it, because both that's still a passive modality versus movement, where movement is actually an active modality that helps to push the inflammation out. And elevation, same thing, another passive modality here. So when I say passive, it means just, again, you don't have to do anything for that. It just automatically happens by an external device. Now, if you look, I looked up a couple different acronyms. I found a few different ones that I want to just quick touch on here. One that University of British Columbia uses is MOVE. And what they say for the MOVE is movement, not rest. What else do they have? There we go. Movement. They say options, so offer better options for their cross training. V is vary rehabilitation with strength, balance, and agility. And E is ease back to activity early for emotional health. That's an okay one. So move. One that I had heard before was MEET. So the M stands for movement, the E stands for exercise, the A stands for analgesia, and the T stands for treatment. So it's the same thing, like movement, exercise, getting back to those early. The NSAIDs, so the analgesia. So they talk about NSAIDs, but they talk about, again, you can use the ice, the heat, like something to distract from some of the pain. And then they talk about treatment, right? So it's, yes, PT is what I'm going to say, but I mean, just seeking out help with this right away too is going to really expedite the healing process for you.
So Nick, what
And
is the difference between, I'm sorry?
well, and there was one more that I found, and I just thought it to be funny.
Okay.
Well, they said why you shouldn't do rice for sprains was the title of the article, and theirs they call it is meth. And I was like, you couldn't come up with something better than meth. It didn't seem like the best acronym to use, but they use movement, elevation, traction, and heat. So they're going against that with some different things. But again, I think the big thing that you're seeing here is movement. Movement is going to absolutely be key early on, and learning to do the right movements early on for sure, if we're talking like a very acute injury.
Sure. Okay, so my question is, one of them is MEET. What's the difference between movement and exercise then for your knee pain?
So
what are you supposed to be doing?
movement, they're saying, and I agree, it's just like, if I'm just standing there, well, I'll use my elbow. So it's just easier to see. It's like just bending it back and forth. So it's not, yes, technically, could that be an exercise? Of course. But when we're talking exercises, and then maybe like doing some heavier squats, going for a hike, doing whatever it is you want to get back to some yoga, maybe, right? Versus, again, just generally getting movement. Get it moving this way, get it moving that way. Maybe it's a little bit elevated when I do it, so I get some of that passive draining. Like I could do the same thing with my leg, getting it up, but it's just not being shy to use it versus actually going a little bit harder with maybe some of the strengthening, the balance, the agility, all of that type of thing.
Okay, thank you.
Yeah, great question.
Right, check this out. A walking aid, acupuncture, and your shoes.
So the walking aid, I think, goes back to the don't risk falls, right? Yeah, if you need a cane, crutches, I mean, use them, but don't rely on them. Acupuncture, yeah, wholeheartedly. Like I am a big fan of acupuncture. Now, acupuncture is going to treat knee pain differently. I will say that. Like, it's not going to go to look at a mechanical thing that's going on with the knee that we would look as a PT. It's going to treat the different meridians, the different energy channels, and if something else is causing the knee pain, it's going to be more beneficial versus maybe something like dry needling that's going directly at the knee to really go at knee pain from a mechanical standpoint.
Okay. And that's something that would it wouldn't just be one treatment and done. It would, I mean, obviously depend on the injury and the severity of it, but acupuncture is something that would happen over time.
Yeah. And that's where I always recommend, like, I don't speak a lot to acupuncture. I encourage people to try acupuncture because I've seen how profound the benefits are. One of my good friends is an acupuncturist, right? So I try, I like give very basics on it, but say, no, give them a call. Like most acupuncturists will talk on the phone with you even just for 5-10 minutes to see if they can give you some help too. And I think in a lot of cases, you're going to get a lot of help from them actually.
Okay. All right, let's see. Sir, knee pain, how to eliminate knee pain. Let's see if we get anything different.
Yeah,
Medical news today.
sure.
All right. 14 home remedies.
Ooh, home remedies. So this is good. So physical activity, again, nothing much new there.
Okay. Strengthening exercises.
Again, same thing. So, yeah, and I think this is a good thing. Like you're seeing ones that I would be in agreement with as a PT, but it's also just on your big websites, if you will, too. So some of them they're definitely hitting all right.
Sure. Okay, posture and support for your knee.
I'm just looking to see like what they're saying here, where it's yeah, the posture one. I'm going to encourage good posture no matter what,
Sure.
right? Because I know, yeah, it's you can have carry over from this posture to that posture. So yes, I'm going to agree to that. But the supportive shoes, because of arches. Oh yeah, and they touched on that in the last one, cause abnormal wear and tear on the knee, right? But here's the thing: you have to attack the foot then too. If you're just all that is relying on is another crutch, right? You can't just say, oh yeah, well the orthotics help my knee pain. Yes, they did help your knee pain, but now they've made your foot rigid. Now they've changed your gait mechanics. So there's so much more that goes into it than just wearing support or wearing a knee brace. While that may give some support and a little bit of relief at the time, you're still not addressing the problem. And I think this kind of the orthotics one there, or supportive shoes, brings up a good point. A lot of times, unless there's a traumatic injury to the knee is not at fault. You still have to be attacking the foot and the ankle and the hip because those are what control a lot of the knee movement. So this is something that I don't think I saw as I came across things, but wanted to bring that up for people too.
Yeah. I know for me, I have knee pain from time to time from playing volleyball, and it was just the certain movements that my legs were rubbing a certain way, like the ligaments inside my legs, and that was, I had water on the knee, I guess, like an operation, but yeah, so it just depends on the movement of it, I guess. It's not necessarily that I even like fell on my knee or I twisted my knee. It was just like the overall movement that was causing the problem. So I get that. But this,
Weight loss diet, yeah, eat an anti-inflammatory diet. That's going to help with all things.
yeah, medications.
Okay, medications. Just looking at this, this is kind of wild. So they say like the non-steroidal anti-inflammatories, so your classic NSAIDs, you can get those over the counter. Okay, you don't want to rely on those, right? Like if you read what it says on there, you're supposed to only use it for a little bit before consulting your doctor. So still got to be careful on that.
Yeah.
I like that they talk about topicals there. So topical capsaicin, which is chili pepper extract, basically, or like the classic Bengay, icy hot. Uh, trying to remember, there's another one.
Biofreeze.
Thank you. That was the exact one I was trying to think of, right? So I think all of those things, as long as you don't get a lot of like garbage ingredients in them, because there can be a lot of fillers and a lot of other things, they can be good. But again, it's just like the heat or the ice, right? Because, well, capsaicin is the heat. All the other ones we would talk to are usually going to have a cooling effect. That's what they're meant to do. So it's going to give that relief from the nerve being hyperstimulated. So it's going to give it a little bit of a different stimulus. Now it goes into the steroid injections to the joints. Like that's a big deal now. Now you're putting a foreign body into that joint. So you're increasing any very minimal risk of infection, but it's still there. But the steroids are going to cause a breakdown. So you got to be careful with these things. Not that they're not very beneficial. It's just you got to be wary how many of them that you're having. And then it goes immediately to tramadol, where it says, but below, experts do not recommend using opioids except for tramadol. I don't know why that's on there. Travis and I have talked about some of these before about just opioid epidemic, and it's scary. Like to jump straight into something that aggressive. I mean, if you're in that much pain, we got to clear this up, right? There's something seriously wrong there. And tramadol still has a high likelihood of addiction too. So you got to be careful with it. And again, not to say any and all of these aren't appropriate, but all they're doing is
Prolonging the.
covering pain. There's still pain there for a reason, and getting to why that is there, that's the ultimate what you have to do.
Okay, so we are at our time right now, but I just wanted to
Oh, I'm
ask.
good till 12:30 if you are.
Oh, okay.
Yeah.
Well, then let's do it.
Yeah.
Keep going down the list then. But okay, massage.
Massage. And I think we talked about this on the previous one for back pain too, right? It's massage. I'm gonna agree to that. Get in there with those short, tight muscles, work them out, get some of that. I mean, we're gonna be doing hands-on in PT too. So yeah, absolutely, that's a good idea.
So I have a roller massager, and I was rolling out and caused some bruising. Is that something to be concerned about? Was I just pressing too hard? Does bruising really matter, or is it just like going through the process of releasing those muscles?
It depends. Uh, really, it might have been too aggressive. It might have just been, hey, that stuff was tight in there, right? And sometimes you do need to be aggressive. But okay, I'm glad you said that because, Lauren, this brings up a great point of different layers. So fascial systems have different layers. So you have your much more superficial, like right at the skin level. You have like just as the skin, like everything's kind of touching onto the muscle. You have midway through the muscle, you have deeper into the muscle. So you do need to give different forms of pressure. So it can be a very light to more of a moderate, and then even like into a deeper as you're going through any type of soft tissue. And I think the lighter and even the moderate just get overlooked more often because more is better, right? You got to get in there, got to dig it out. Well, yes, that's true, but if all you're doing is just going crazy aggressive, you're just going to hyperstimulate the body, and that's going to lead to other problems too.
Yeah. Okay. Noted. Essential oils and aromatherapy.
And I think this goes with a lot of the uh, topical things like the capsaicin, the Bengay, like that we talked about before. It's just a different form of that. Where I think, yeah, these can be like made into an oil and used, rubbed on. Yeah, I think that they would absolutely help you out.
Okay. So this is the same thing we went over earlier.
Up again.
Heat and cold.
Yeah.
Climate.
That's a good one actually, because more that I would want to say barometric pressure. So changes in the pressure of the atmosphere, not just overall climate. Yes, because some people want a warmer climate, some people want a cooler climate. I know they talk about here maybe you want a more pleasant climate, but I think it's what is pleasant to you, right? Like live where you feel comfortable. But humidity, pressure changes absolutely affect things. So to think that they don't, if you're in an area where it's 50% humidity, but then it's up to 90% humidity and back down to 70 and then up to 85 and down to 60, like that up and down, that's going to cause a ton of pressure changes in the joints and can cause a lot of irritation, especially with arthritis.
Really? Okay. Acupuncture. Tai Chi. I know you're a huge fan of Tai Chi.
Tai Chi, about it? Yeah, because it's that. So we talked about movement versus exercise. I would say Tai Chi is almost a combination of both, where it's an exercise, but it's just that, like when I think of movement, I think of just that very rhythmical, almost soothing type movement. And that's where just that Tai Chi, just those slow flowing motions, I think are great for pumping the joints, pumping just all of the tissues, the nerves, the muscles, the fascia, the ligaments. So you're not getting so much irritation, if you will, and just oftentimes very well tolerated.
Okay. Medical marijuana.
Yeah, and here's another one. Like, well, it says medical marijuana, but then it says CBD. So both of which can be very anti-inflammatory, can be very good as far as pain control goes. And look at me, I absolutely agree. If you can go, and I'm saying it, not that you're going to grow something in your backyard, but if plants are medicinal, right? Whether it's marijuana, whether it's peppers, whether it's beets, whether it's lettuce. I mean, all of these plants just have various medicinal properties. So I think to throw any of them out, I don't like that idea. But to use them And in this case, marijuana would have to be used responsibly. Great idea.
Okay. Apple cider vinegar and other foods.
Yeah, apple cider vinegar, nice anti-inflammatory. Not much else to say on that. I think it's just an overall anti-inflammatory diet. I like that they touch on collagen, gelatin, raw foods. But again, raw foods, provided you can digest it well. Apple cider vinegar, huge for digestion. Putting some of that on some raw foods can absolutely help. But I also like that they talk about avoiding dairy. Acidic foods, yes and no. Nightshade vegetables can be problematic, but they just said dairy and nightshades as far as inflammatory foods. They're not touching here on alcohol. They're not touching on sugar. They're not touching on, for me, the biggest one of all, which is just industrial seed oils. So canola oil, just everything in that. Just search industrial seed oils. You'll see a list a mile long. Corn oil, peanut oil, safflower oil, sunflower oil, whatever it is. They're just garbage and they're going to cause so much inflammation. And not just for arthritis suffering, but these are really important because if you don't actually have the right healthy fats on board, like saturated fats are going to be actually a big one, but also you need monounsaturated fats, polyunsaturated fats, because they all make up a cell's membrane. And if you're coming back from an ACL injury, right, and you're making it out of basically the cell membranes out of garbage fats, trans fats, anything like that, you're not going to have the stability going back there, and you're going to get into more trouble. So, yeah, I'm glad that they touch on things to avoid, but they missed, I would say, even actually the biggies.
Yeah. All right, so that's this list. So what I want to ask you is, as a physical therapy company, like, what is our advice in of course, everybody's going to keep Googling. I Google stuff. I try to figure it out. We try to piece it together the best that we can on our own. But how can we help other people choose the right first step in getting rid of their pain?
You've already made, well, first of all, the right first step by trying to do something about it. And that's what I want to commend people for that, because that is something that goes overlooked, right? Where it's, oh, yeah, it'll go away, right? No, you're actually actively searching. You're already going to be better than a lot of people will be. Now, as far as what else then that you can do, the right first step, I'm always going to say, hey, come in for PT. It's hard for me to go against that, but it's because I know the process for it, right? Well, somebody goes to see their doctor. Now, okay, maybe the doctor puts them on some more NSAIDs for a month. The pain helps, but it's not gone. All right, maybe we'll go get some imaging. Ooh, imaging. That's something we should quick touch on, right?
Yeah. I have a lot of people reaching out asking or saying that they're going to go see their doctors for an
Yeah.
MRI and because they want to get down to the root of the cause, but it's hard to explain. So go ahead and
So the one reason I want to talk on imaging is there's something called the Ottawa knee rules. So there's a lot of Ottawa rules, and what it talks about is, as far as like when an X-ray is appropriate. So I'm going to read off the exact Ottawa knee rules. So a knee X-ray series is only required for a knee injury patient, so specifically with injuries, that's less than 7 days old, and it includes age 55 or older. You're just an automatic yes if you like had a fall on your knee or something. If you have isolated tenderness of the patella, so that kneecap is just super tender, tenderness on the head of the fibula, which is on the side. You can look it up to see like if you really want to see where that's at, or you're unable to bear weight immediately after the injury, and if you go to the emergency department, or if you can't take more than 4 steps, like that's when you need an X-ray under those circumstances. Other than that, if you're seeing any type of medical practitioner, if they're not doing hands-on tests to be able to tell everything that you're going to see in that X-ray, that's a problem to me, because I can tell you by doing tests if there's arthritis, if there's an MCL injury, an ACL, PCL, if there's a meniscal injury, if there's patellofemoral problems, if there's any of these problems, if there's IT band problems, if there's, so you should be able to do most of those through manual testing without the need for an MRI. And that's one thing I think is a big deal. Like, this is why, in part, without getting into like an insurance rant too, right? Hey, people don't want to pay if they have high deductibles, lots of this. It's tough. So that's why sometimes just like going, PT, get this checked out because we're going to be doing all those, or going to see your ortho, seem like let them do those tests and see kind of what's going on. That's going to be the biggie. But I mean, get hands on with that testing. A lot of times it's going to tell us more than looking at an X-ray to see how you're moving and what really is injured on the knee.
Sure, sure. Um, so another thing that we often promote are self-tests for knee pain. So I just pulled up our blog right here. I went to knee, and here's self-tests that you could do at home as well. And then we also elaborate and go into top 3 causes. So all the educational resources are there for you guys if you are experiencing knee pain. Just go to robinsptwest.com/blogs and you will find all the information you need on that. But if you have any other questions, or if your pain is increased to a really uncomfortable level, then I think you're probably going to have a better bet reaching out to us for a screen. But I did.
Can they
Go ahead.
sign up? I forget. Can they sign up for the Ultimate Guides when they're finished? Because the knee one should be done soon, right?
Yes, our knee ultimate guide. So it's a knee pain magazine essentially. It includes all the causes and the stretches and the best things that you could possibly do for your knee pain. That's coming out soon, and you can get that by going to www.robinsptwest.com/guides, and then it'll list all of the guides that we have, and then you can click here to get one, and it's as easy as that. It'll instruct you every click you make. Aside from that as well, I did want to touch on something else. We are currently beginning a fundraiser. It's Distance for Dollars. It's a great cause, and it supports one of our patients who is struggling with cancer right now. And it's a very good way for us all to get active. So what's going to happen is that for every dollar that we collect that is donated, we're going to put it in a pot, and then we're going to divide it amongst all our team members, you and I included, Nick, and we have to each do a mile of something, whether it's kayaking, jogging, biking, running. So if anybody wants to participate in that, I will link that on our wall on Facebook, and you can go from there. But we're really excited to get that going and help somebody out that we really care about. Do you have anything else for today, Nick?
No, I think that's good. I was quick just heading over to the comments to see if there are just any big questions here.
What does METH stand for? I saw somebody asked.
METH, I already closed out of it, but it was movement, exercise, I think treatment, and I think it was heat. Yes, there we go. That was it.
There you go. Lee, that was for you. All right, I don't see any other questions on our wall right now, but as always, if you guys have anything that pops up, anything at all, feel free to message us or comment below. We're happy to help.
Perfect. Thanks, guys. Have a great week.
See you later.